So today's surgery, this video is literally for everyone. Now, what I'm going to show in today's surgery is that this video is for all those patients who have recurrent nose blocks and nasal allergies. So patients have complaints of chronic nasal blocks. They are not able to sleep properly because their nose gets all choked up and blocked up because of the allergies they have to certain things, like the most example being the pollution, the dust out there. Now, so what I'll be showing in this surgery, now this is for everyone. Now, that's the instrument which I'm trying to show. Now, that's the posterior attachment of an organ called as the middle turbinate. And what I'm touching right now is the inferior turbinate, which I have taken off almost 90%. This is a patient's left side nasal cavity. What I've just opened up is a flap in which there was a deviated nasal septum, which I'm trying to outline right now, which also I have removed and made that straight. So now I'm going to show you the that's the area that's the organ called as middle turbinate. You can see it is curved and being pressed on. As you can see, it was being pressed on by the deviated nasal septum, and it has caused a memory effect on that anatomy. Now this area which I'm showing you right now is the area where the olfaction receptors are. That whitish mucosa you can see up there in the center is responsible for a sense of smell, which was blocked off because of the deviated nasal septum the patient was having. Now I removed that. Now you can see that area was completely covered by that inferior turbinate hypertrophy, the organ which you can see which I've reduced in size. Now this organ is mostly responsible. Now as you can see, I can take my scope in and out very easily. Now that was the area which I cleared. Now that's the middle turbinate, that's the middle meatus area. So I've corrected the inferior turbinate hypertrophy. Now, what happens? The inferior turbinate is basically an erectile tissue. So whenever a patient has nasal allergies, it maybe between within few hours or immediately within few minutes or maybe within 48 hours, the patient may get severe nasal watering, and the patient may also land up having a severe nasal blockage, which may result into a severe headache sometimes. So the inferior turbinate is an erectile tissue, has a lot of blood vessels in that, and they swell up 3 to 5 times more of its original size. So your nose gets blocked off. So in short, I'll show you again what I've done. Now that's the patient's right side. I'm just trying to show the anatomy over here. So that's the area on the patient's right side where the sense of smell receptors are present. So as you can see, this was the patient's right side. Now my endoscope is easily going in and out. Now I've taken off that inferior turbinate tissue almost 85 to 90%. That entire area which you can see my instrument going out like a tunnel shaped area, that was completely blocked by that inferior turbinate swelling, the hypertrophy which we see in patients with nasal allergies, which can give rise to the nasal blockage. Now I've removed that completely, which will give permanent permanent relief from nose blocks to the patients with nasal allergies. Now, point to be remembered is that I do not remove the entire organ. Now, this is a patient's left side. You can see that part of the organ which I've removed. Only 10 to 15% of that inferior turbinate I have left intact. Anatomy also I have preserved. I haven't changed the shape of it because the functioning still remains the same. However, the obstruction is removed permanently. So there's one more thing, one more part to the surgery. I'll just show in some time. Let me just focus my endoscope a little bit. So what I'm showing here right now is the patient's right nasal cavity. I'm using an instrument called as the coblator. The technique is called as coblation, and you can see I'm just burning the posterior most or the end part of this tissue. You can see, which is called as the inferior turbinate. So I use that instrument to take off almost 85 to 90% of the hypertrophy or the swelling of the inferior turbinate, so that permanently that tissue is gone for good. So whenever a patient is having nasal allergy or is exposed to dust or pollution or any sort of allergen out there, this swelling will never ever come in his or her life. So the patient will never end up having any nasal block, so that the patient will have a sound sleep. will not get up in the middle of the night. Also, he will not have a choked nose. He will always have a 24/7 open nose. Second part to this surgery is that we also, now there's a nerve which is responsible for the nasal watering, the sympathetic and the parasympathetic nerve supply. So whenever dust or pollution or any particular allergen, cat, dog, dander or hair or pollen goes inside, now that's the instrument I was showing. That's the middle turbinate. That's the posterior most attachment of the middle turbinate. So what we do, there are certain nerves which control the nasal watering, the part which I'm showing you right now. These nerves come out in this region and supply the entire mucosa inside, which is responsible for the nasal watering. So if I use the same instrument, the corblator, in these areas which I've shown and burn that mucosa or that area which I'm showing right now, all that area is carrying a lot of nerves, the nasopalatine nerves, which is responsible for the nasal watering. So we do a kind of a neurectomy in this patient, and what happens with this is that, as you can see in some time now, I'm gonna burn that completely, that particular area, and that is under controlled method. Do not overheat that particular area. We have to have a controlled motion inside. So once the nerve sensation is blocked off, as we burn that tissue, the sensation of that nasal allergy in response to which the nasal watering was happening will reduce by almost 75 to 85 percentage, so that when a patient is having some kind of nasal allergy next time, the patient will never ever realize that there is excess nasal watering happening. So the patient will not have a nose block. The patient will never have a nasal watering episode at all. So the patient will be free completely of the nasal allergic symptoms. However, the patient will be allergic, but the symptoms will be gone almost forever. So that's how we deal with patients with chronic nasal allergies who are not like responding to the medication therapy, or the medication therapy is not working for them. So this is how we do surgeries. This is how I do surgeries for my patients, and it has a very good success rate.